Well, there you have it. Looks like Trump wasn't just dreaming about that fucking death penalty for people that certain drug dealers. That's these code words that these guys are using for this thing is kind of baffling. But I don't know. I didn't think that there was much to this story, and just like somebody else in the story says, I thought this shit was just kind of like hyperbole or something. But no, this is real. This is fucking real. Uh-oh. Don't know what that is. But anyway, what we have here is, I don't know, it sounds like a little bit over the top, all right? And if you think you're going to fix the opioid crisis with any of the ideas that the Trump administration has put forward, you are a fucking idiot. There's just no excuse for this line of thinking. We tried this, incidentally. Guess what? This didn't work. We tried this with heroin back in the 70s. We tried this with crack in the 80s. This kind of fucking using a jackhammer to fix a problem with your eggshells, it didn't work, man. You know how I know? Because heroin's still one of the number one killers on the street. It kills more people than gang members. It kills more people than fucking people driving, recklessly and running people over. What in the fuck? You know what? It didn't work for crack either. Number one cause of death, overdose deaths for black men is crack or cocaine. I would have to say crack probably is, the statistics probably will bear out that crack is more in the overdose category than just regular coke. At least the numbers I've seen. And then those numbers are always muddied up, and there's a lot of mixed drug mixtures in there, and that's why you get a lot of people claiming that this drug epidemic is some kind of a poly problem. It's mostly a fentanyl problem. All right, let's face it. We've been talking about this for a while. We didn't see these kind of spikes until about 2005, where it's just like jumping like crazy. The numbers of people that die of fentanyl combos. It used to be like, oh, they're experimenting with it by mixing it with heroin. No, they're just seeing what they can get away with, guys. And this is absolutely crazy. And I don't know who he's talking about. We'll go through it when we get to the end, but I think I'm just going to read right through this because I might have a couple things to add to it or say, but I really, I'm saying everything I need to say, You can't fix this problem with these methods. You can't scare people out of doing drugs. That's just not, it's not realistic to even think like this, all right? The Trump administration is finalizing a long-awaited plan that it says will solve the opioid crisis, but it also calls for law enforcement measures like the death penalty for some drug dealers. That public health advocates and congressional Republicans warn will detract from efforts to reverse the epidemic. The ambitious plan, which the White House has quietly been circulating among political appointees this month, could be announced as soon as Monday when President Donald Trump visits New Hampshire, a state hit hard by the epidemic. It includes a mix of prevention and treatment measures that advocates have long endorsed, as well as beefed up enforcement in line with the president's frequent calls for harsh crackdown on drug traffickers and dealers. And now remember, he praised Duterte for his efforts in a private phone call that was leaked, basically, hey, good job killing drug dealers and addicts. Great, bang up job. And he also praises Singapore and other countries that have capital punishment for drug dealers. He acts like China, oh, it solved the problem in China. He asks the China guy, hey, you guys got a drug problem? And he's like, not really. And he's like, oh, okay, well, why? Oh, I don't know, we kill fucking drug dealers. Oh, okay, cool, that sounds like a good idea. Except for that's not really how they don't have a drug problem, and it's not really like they don't really not have a drug problem. All right. if they didn't have a drug problem, how come they're getting away with producing all these like experimental drugs that keep flooding the market in America? They constantly are getting blamed for producing the fentanyl that's killing people all over America, and they're constantly getting blamed by other countries for all the meth that's going on in their countries. So if China don't have a drug problem, they're pretty good at hiding it, you know. They definitely have a drug dealing problem, if all those things are even true. Trump's plan to use the death penalty in some cases found at least one fan among congressional Republicans, Representative Chris Collins of New York, one of the president's most consistent, brown nosers. I'm all in on capital punishment side for those offenders that would warrant that, he said when asked about plans Thursday afternoon, including drug cases. Yep. I just want to know what drug case. What drug case is it where you got a drug dealer who's selling a dangerous substance that's illegal to somebody that wants that substance, knowing that it can kill them and that it's highly illegal? Where does that warrant the death penalty if that person that takes the drugs that he bought from the drug dealer dies? How do you fucking go there? The dude already knows he's taking a fucking highly illegal, highly dangerous, deadly substance. You can't deter a business transaction like that by acting like there's a death penalty if you get caught doing it. That's not a deterrent. Several congressional Democrats said they were alarmed by Trump's plan to ramp up punishment. Quote, "We are still paying the cost for one failed war on drugs, and now President Trump is drawing up battle plans for another," said Senator Ed Markey of Massachusetts. Quote, "We will not incarcerate or execute our way out of the opioid epidemic." And nowhere in this article and many others that I've read about this lately, nobody that's talking about the opioid epidemic and trying to solve the fucking thing ever brings up cannabis. I mean, I'm not saying it's going to solve the thing, but, you know, when you're talking about things that you think are going to help, legalizing medical marijuana, which has been proven to help, or let's give the death penalty to certain drug dealers, whatever the fuck that means. And the more I listen to what Trump is saying, the more it sounds like he means the opioid manufacturers or something. I don't know. Because when you say that there's somebody out there killing 2,000 or 3,000 people and they only get 90 days, that sounds like he's talking about the guy like that runs fucking the OxyContin family. Sounds like he's talking about the guy, that just got busted with incest therapeutics. I mean, those guys committed felonious fraud, like ridiculous amounts of fraud, bribery, you name it. Like the guy that got caught from incest, not the CEO, he also got busted, but we're just talking about the fucking sales rep guy who talked to doctors and paid them through speaking fees and shit. Are we going to give them guys the death penalty? Because that's crazy, man. Those are your buddies, Trump. The billionaire class, The White House's most concrete proposal yet to address the opioids comes after complaints from state health officials and advocates that Trump has moved too slowly to combat the epidemic after his bold campaign promise to wipe out the crisis touching all parts of the country. However, the plan could cost billions of dollars more than Trump budgeted, and likely far more than any funding package that Congress would approve, raising questions about how much of it can actually be put into practice. Trump's emphatic embrace of the death penalty for some drug dealers has also alarmed some advocates who say the idea has been ineffective when tried in other countries and resurrects the nation's unsuccessful war on drugs. I mean, the war on drugs is far from dead, so resurrecting it? No, just bringing back parts of it that we already know don't work. All right? Like the Just Say No campaign, it either didn't work at all or the fucking opposite. It backfired. More people did drugs after they went through the DARE program than if they wouldn't have went through it. Well, I mean, duh, no brainer. You're fucking teaching fourth, fifth graders, sixth graders. You're teaching little kids like that about heroin and PCP and meth, crack. It's kind of a no-brainer. The younger you teach kids about shit like that, whether you tell them it's bad or not, especially, they're going to fucking do it. So how stupid is Dare? But anyway, the whole plan, everything that they tried, like increase in interdiction, decreased funding for intervention, it's just failed. That's why we don't do them things anymore. The shit failed. Anywhere where they still do them, they're just doing it because there's corrupt people in place propping that shit up. And you know that's why it is. I mean, just a perfect example is all the people that are involved in Trump's administration that are in the so-called opioid commission. It's just all a bunch of corrupt people trying to get their agendas through, and we'll see what those are in a minute. Under the most recent version of the plan, which has gone through several revisions, the Trump administration proposes to change how the government pays for opioid prescriptions to limit access to powerful painkillers. So right off the bat, they're punishing people that legitimately need these painkillers, acting like that's going to stop something. It also calls on Congress to change how Medicaid pays for treatment, seeking it to make it easier for patients with addictions to get inpatient care. Aha. So, instead of really helping people, they're just kind of like putting you on the shelf, putting you on some methadone, put you in some all this shit that I just said. Chris Christie's plan would have enriched the rehab industry, and that's what this shit is. It would also create a new Justice Department task force that more aggressively monitors internet sales. All this is to punish actual people that need the opioids. The administration claims its plan will reduce opioid prescriptions by 1/3 within 3 years, and that the initiative will fulfill Trump's campaign promise to stop opioid abuse. You know what else could lower opioid prescriptions by 1/3? What has already been proven, and that would be medical marijuana. I hate to keep beating the horse, but no one's even mentioning it here. But what Trump's saying is that if you fucking actually physically, financially cut off people from getting opioids by cutting Medicaid and cutting how the government pays for opioid prescriptions, and you can guarantee that you can cut 1/3 of prescriptions off within 3 years. You're talking about just kicking people off of opioids that have been on them for many, many years. And this is no good. One thing about rehab is it doesn't work when you force it on people. This is going to throw a lot of people into the black market, and you're going to see a lot of heroin uptick, and you're going to see a lot of heroin overdose uptick, and you're going to see a lot of heroin death uptick. So that's the only thing that this whole chunk of shit right here that they're talking about doing will do. That will be a tall order. There are more than 64,000 drug overdose deaths in 2016, mostly involving opioids, according to the most recent federal mortality data. The CDC last week reported that emergency rooms recorded a 30% spike in opioid overdoses last summer, indicating that the devastation is much worse than, it was before, and it's only getting worse. And I'm telling you, mark my words, unfortunately, this shit, after all this is put into play and the wheels are in motion on this, two things are going to happen, one or the other. Either the opioid deaths are going to remain exactly the same, at the same rate we're looking at right now, like 100 people a day, or it's going to go up. And when it goes up, it's going to, what are you going to do? They're going to crack down even harder. That's what they did when this failed in the 80s, and it's like carpet bombing, really. Many of the measures in the plan were recommended by the President's Opioid Commission last fall or discussed at a March 1 White House Opioid Summit. For instance, it endorses a long-promised priority, greatly expanding first responders' access to naloxone, a medication used to reverse opioid overdoses. It also calls on states to adopt a prescription drug monitoring database that healthcare providers can access nationwide to flag patients seeking out numerous opioid prescriptions. So that should scare people. Well, the naloxone part shouldn't scare you, but what they're doing with that, they're assuring, their plan doesn't work unless they cradle to the grave you, meaning They start you out with doctors that prescribe you opioids for your stub toe. And then you go from there to addiction because you worked your way up the pill ladder and now you need something stronger than fentanyl patches to get your clouds on. And then they kick you off once you get caught going to more than one doctor, and you're right out in the streets. And then when you overdose on heroin, they come around and they hit you with the naloxone, put you in the methadone clinic, and get you right back into, their cradling. They get you back in there and they give you a big hug. And one of the drugs that they use in end of life medicine, which hospice or whatever you want to call it, is opioids and benzos. I remember I had to do that. It's not cool. On the policing side, the plan would ramp up prosecution and punishment, of course, because that's what Republicans always do this with the drug war. Oh, we got to just make it harder, once you get caught. That's ridiculous. This is the fucking most ridiculous thing I've ever heard of. Like, yo, we did all this shit. It didn't work. But that's the way Republicans are. They don't have any fucking care about what, learn lessons from the past. I mean, look at their tax plan. It's the same fucking thing Reagan did. Oh, yeah, we're going to make it so we don't raise taxes anymore. Yay. And then we're going to spend way more money than we ever spent before. Cool. That doesn't fucking make any sense, guys. Just like this don't make any sense. Ramp up punishment. Okay. That's underscoring the tension between public health advocates and law enforcement officials' approach to the crisis. Public health advocates say the nation's opioid epidemic should be treated as a disease, with emphasis on boosting underfunded treatment and prevention programs. But some law enforcement officials back tougher punishments as a deterrent, especially for drug dealers. The two camps don't always see eye to eye, at times putting Health and Human Services and Department of Justice officials against each other. And neither of them want marijuana to be any part of this solution. So there's that. There's a lot of internal discussion between health folks and enforcement folks, said an official involved with crafting the plan. Yeah, don't forget what Trump said. Let's see.
Mr. President, do you have a drug problem? No, we do not. I said, big country, 1.4 billion people, right? Not much of a drug problem. I said, what do you attribute that to? Well, the death penalty. So, you kill 5,000 people with drugs because you're smuggling them in and you're making a lot of money, and people are dying, and they don't even put you in jail. They don't do anything.
Oh, well, hey, Trump, are you going to put the CIA in jail? Because they're the ones I'm pretty sure that's got all this heroin coming in from Afghanistan. While Trump this month repeatedly suggested using the death penalty to deter drug dealers and traffickers, an idea roundly opposed by public health advocates, many lawmakers have said they weren't sure whether to take his idea seriously. Quote, I would have to strongly evaluate and look at any proposal like that, said Senator Dan Sullivan, Republican from Alaska, on Wednesday. I don't know if the president was serious or just said it off the cuff. It's a big issue when you decide to bring a capital case or pass a law that allows for capital punishment. There's only a few things that they even allow for capital punishment for. And none of them are quote-unquote victimless crimes. Because, like I said, if you're a fucking drug addict looking for a highly illegal substance that's very dangerous and illegal and deadly, you don't get product liability. All right? The fucking manufacturer, the distributor, none of them people are liable for your actions. Why should you give the death penalty to a drug dealer when they're fucking just selling somebody something that they're trying to buy anyway? According to the language circulating this week, the Trump administration will call for the death penalty as an option, quote, in certain cases where opioid, including fentanyl-related drug dealing and trafficking, are directly responsible for death. Senator Shelley Moore Capito, Republican from West Virginia, whose home state is one of the hardest hit by the epidemic, says she doesn't support the death penalty for drug cases. Quote, I mean, I get the message he's delivering. We got to treat it seriously, she said. Quote, I don't see that it's going to solve the problem. The White House plan also calls for making it easier to invoke the mandatory minimum sentence for drug traffickers who knowingly distribute illegal opioids that can be lethal, like fentanyl. Hey, I thought that didn't work, like, for guns. Like, if you're not going to make a gun rule that says, oh, hey, you can't have a bump stock, which makes a semi-automatic fully automatic. Or, hey, maybe we should maybe we should ban 30-round banana clips like we used to back when Reagan got shot. Or maybe we should ban, I don't want to say the word assault rifles. Maybe we should ban rifles where, you can shoot off 30 fucking rounds as fast as you can pull the trigger. And they're, tumbler rounds that are almost the same thing as NATO rounds. And they're high powered. I mean, what more do you need to say? You can't deter people from getting all those things that I just named. The bump stock, the tumbler rounds. Hell, you could get fucking armor-piercing bullets. Even if they made all that shit illegal, you still can get it all. And it doesn't deter shit. And they're not going to make a rule that makes it so it deters you, because they're acting like, oh, it won't deter anybody. If somebody wants any of those things, they can go get them anytime they want. And people on the left are always like, well, why even make any laws then? And people on the right are like, well, that's absurd. Well, it's the same fucking, just apply it here. It's the same thing. Oh, you're going to make it so you can get mandatory sentencing for fucking peddling in fentanyl? It doesn't make sense. It doesn't make sense how you think that the black market only works for guns, when the black market pretty much is only there for drugs. If you fucking legalized and regulated somehow or whatever, medically distributed all drugs, eventually it would probably dry up out there. And the black market wouldn't really have much to go on now, would it? All right, there's also this new Justice Department task force known as Prescription Interdiction Litigation, or PIL, which would be empowered to step up prosecutions of criminally negligent doctors, pharmacies, and other providers. That's the thing that Jeff Sessions announced a couple weeks ago. He was pretty excited about it. To me, it seems like that's their micromanagement system. That's where they're going to go directly after patients and doctors. And, hey, maybe they will find a doctor that prescribed too many fentanyl suckers and a couple people died from them. Maybe they will give them a death penalty. I mean, is that where we're at with this shit, guys? This is fucking absurd. The White House is also backing new health ideas, such as calling for 75% of opioid prescriptions reimbursed by government health programs like Medicare and Medicaid to be issued by using best practices within 3 years. That would be scaled up to 95% of prescriptions in 5 years. So once again, basically picking directly fucking with the poorest people and probably the oldest people in the society we live in. If you're on Medicare or Medicaid and you're getting fucking opioids because you have cancer or fucking some kind of back pain that you've had for 30 or 50 years and you need your 2 or 3 Vicodins a day, you're going to be carting your ass up to the doctor every 30 days whenever you need that refill. Hell, we might even make it every 15 days. That's what best practices is. You ever heard of best practices before? They're not really that good if you're a patient, trust me. And they're talking about scaling that up to 95%. So the government basically is no longer feeling like it wants to pay for any of this shit. And if you look at the numbers, you can't make a case to say that the government is providing all these people with opioids that are dying and are problem, the people that have the substance abuse disorder that they always talk about when it comes to marijuana. And they're trying to prohibit marijuana. They're like, oh, substance use disorder. Oh, yeah, well, what about it? You don't give a flying fuck about the fact that, yeah, there's 5 to 10% of society that are just going to abuse substances. No doubt about it. For one reason or another, or sometimes no fucking reason at all. They just feel like being self-destructive or whatever. So it also calls on Congress to formally repeal this rule barring Medicaid payments to residential treatment for opioid addiction at large facilities, which could cost tens of billions of dollars. What they're saying there is, okay, we're going to open the floodgates up for Medicaid to pay for the more expensive rehab places that you've heard about. And I don't know how Medicaid can afford that when you're talking about cutting people off of their fucking Vicodins up here. That's just absurd, but whatever. The rule, implemented about 50 years ago, was meant to discourage mass institution of people with mental illness, but states say it has been a barrier to addiction treatment. That's because these corrupt players that have these rehab facilities, like Chris Christie and his buddies, what they do is they build up this repertoire to make it look like it's a state facility, but really it's privately owned, but they're still getting fuckloads of money from the government. And, you know, they got to do certain things and jump through certain hoops. But basically, they are facilities for rehab. And quite frankly, they're probably too expensive for real drug addicts to go to. So the only people that can get in there is little kids that get caught with marijuana. Some states under Obama and Trump administrations both have received federal permission to waive the rule for substance abuse treatment. The plan also includes measures favored by progressive drug policy reformers, like changing the nation's prison system so all federal inmates would be screened for opioid use upon arrival and steered towards treatment in residential reentry centers as necessary. It also calls for improving tracking systems to rapidly steer resources to areas struggling with the opioid epidemic. Trump could announce the plan or aspects of it on Monday, when he is scheduled to return to New Hampshire with the Health and Human Services Secretary Alex Azar. It will be Trump's first trip to New Hampshire as president, and numerous campaign trips to the state to highlight the opioid crisis. If you shoot one person, they give you life. They give you the death penalty, Trump said at the time. These people kill 2,000-3,000 people and nothing happens to them. I mean, it is kind of weird, ain't it, Trump? Well, that's whatever, man. Whatever, Trump. Now this guy, what did he say about weed? Oh yeah, this was just like a last week. This guy is the same guy that said there really is no such thing as medical marijuana. Oh, that's a good one, buddy. That is really fucking hilarious. There's really no such thing as Health and Human Services in the Trump administration. How about that? That's all I got on this one. Yep, it's sad that we can't talk about real solutions, and we can't, you know, it's really bad that we're going backwards on this whole idea that we can take a different approach to drugs in this society. And this, what they're talking about doing, absolute insanity. Absolute insanity. And in case you haven't heard, there's a story, I probably won't cover it until the weekly show or whatever, but what we have is maybe Sessions might be on his way out finally, but it might be Scott Pruitt stepping in. And you've seen what he did in Oklahoma, so he's just as bad.